I'm John Evans. Welcome to another episode of One on One. Covering the coronavirus pandemic, this crisis is impacting every segment of our society right now. Many people have lost their jobs. Many businesses have had to close the doors. Thousands of people have lost their lives. Journalists, like we always do, are asking questions and getting answers, covering the facts of this story, which seem to change hour by hour. How we do our jobs may be different than it was a few weeks ago, but our personal lives are just like everyone else's, filled with anxiety and questions about what the future holds. I asked three of my favorite television news journalists to come in for this week's conversation to talk about what it's like to live in and report on the coronavirus pandemic. Let's introduce you to our all-star panel of award-winning journalists this week. Alex Giles, a reporter and a news anchor at WBTV in Charlotte. Alex, how are you?
Doing well. Just trying to get through this like everyone else.
Caitlin Stansel, reporter and weekend news anchor, WCSC in Charleston, South Carolina. Hey, Caitlin.
Good morning, John. Thanks for having me.
And Jasmine Turner, reporter and weekend news anchor, WWBT in Richmond, Virginia. Jasmine, good to see you.
Good to see you.
All of these award-winning journalists have worked at WECT in the past 5 years or so. All of them now doing the same thing many of us in broadcasting and communications are doing, working in the coronavirus pandemic. And Caitlin, I want to start with you. All of the states in the Southeast are under stay-at-home orders except South Carolina. So how much are things different for you on a daily basis now?
Well, for me, they're not too different. You know, working as an MMJ 3 days a week, I pretty much worked remotely anyway. So working from home isn't that big of a deal, at least for me. I'm grateful to still have my job, though, and still be able to work from home. A lot of people right now, you know, they don't have that luxury. But I will say, you know, as far as the community, a lot of the municipalities around here, the counties, they've had to take it upon themselves to issue their own stay-at-home orders. And then that's kind of created this legal conversation with the attorney general in our state about if those are even legal. Because, you know, he says that it's the governor that has that executive power to do that, not the local municipalities. But the municipalities kind of feel like their hands are tied. So they wanted to do something, whatever they could.
Jasmine, Governor Northam up there in Virginia, his stay-at-home order runs through June the 10th. I mean, it's not just through April, it's April,
Yes.
May, and the first 2 weeks in June. What's it like in Virginia?
So, you know, it's one of those things. I interviewed a Better Med urgent care doctor who said, you know, it's sunny and it's nice. It doesn't feel like, with air quotes, feel like a pandemic outside. But I will say there is a little bit of confusion when it comes to, you know, what does this really mean for us? Or am I going to get a ticket if I'm on the road? So, you know, our governor does every other day briefings, Monday, Wednesday, Friday, trying to clarify questions that continue to come up. And I know that June 10th is a date that's been set with, you know, possibilities of scaling back as we continue to monitor this. You know, Governor Northam is a medical doctor. So he has not just that political side, but he has that medical side of watching it that way as well, and has said, you know, we are not in this for weeks. We're looking at the possibility of months. And so I think that June 10th date had people kind of freaked out. I'm not going to lie. My phone started getting lots of personal text messages. But I do believe that there are possibilities that that could scale back as we continue to watch all this go on.
Alex, on the other side of North Carolina from where I am, Mecklenburg County, if there has to be a hot spot in North Carolina, it's got to be Mac. At least yesterday, I noticed there were more than 400 cases. What's it like working out there now? What's your daily work schedule like, and how much is it impacting you?
It's pretty interesting. Obviously, Charlotte's the big city in North Carolina, and I don't think anybody's too surprised to see that obviously the number of cases continues to climb, especially at this point as we're just entering the month of April and looking at all the projections that people have started to put out. So I would say that the number of cases hasn't really started to surprise me too much just yet. I think the one thing that's pretty interesting about working in Charlotte is the fact that although we're in North Carolina, there are counties that we cover that are in South Carolina, and we're right on the border. So when a lot of people are, maybe dipping into one press conference during the afternoon or during their newscast to listen to what the governor is saying, we're trying to balance, two states. We like to listen to what Governor Roy Cooper is saying about North Carolina. We like to listen to what Governor McMaster is saying about South Carolina too. And so a lot of times it's interesting trying to balance that scheduling. And there have been a couple of days where they've had their state press conferences at the same exact time on the same exact day. And so you're just trying to cover what's happening in both of those states and keep people up to speed. But at the same time, as you're the one on air reporting this information, you don't want to get your facts mixed up because you're trying to balance what's happening in two different states, especially when there's been differences in what each governor has decided to do. Whereas, North Carolina jumped under this stay-at-home order, but South Carolina was a little bit behind that and hasn't used the same verbiage and has tried to almost, it seems like, differentiate what they're doing from what we're doing in North Carolina. So restrictions are in place in both places, but it's just been kind of interesting to see that and to even talk to some folks who are down close to the state line. We've had reporters doing that about how they manage because they kind of live their lives in both North Carolina and South Carolina.
Have you noticed, Alex, people in your community, are they anxious? People on social media, people sending in emails?
I think it's pretty split, to be completely honest with you. I think as you kind of go about the day, you get emails from people and calls from people at the newsroom, and some people are very, very worried about this, and some people will kind of try to self-report when they see people not practicing social distancing. But as we've gone out and about reporting on this and trying to keep our distance at the same time, you'll still see some people look like they're kind of going about their normal days and don't sound too stressed about it. So I think that's interesting right now. I think people are pretty split on it, John.
Jasmine, what about in your area?
I will say one of the things, at least for, before the executive order for the stay at home went into effect, I noticed that the roads were really empty. And then yesterday I was driving home because obviously very blessed that we still have jobs. I had to meet my photographer for a shoot. And driving home around 1 o'clock, I felt like there were a lot of people on the roads. But I think it really just depends on where you are. Kind of like what Alex was saying, you have people who are calling the newsroom and emailing us and sending messages who are, you can tell, very worried about this. I would say the one thing that has been the biggest worry is jobs. So many people having to, be furloughed or completely laid off. And I think the biggest concern is the longer this goes, the longer businesses are losing revenue, the longer families are having to live off of a singular income. And so that seems to me to be the overarching, less about, oh, I can't go out, I can't do this, I don't have my freedoms, so to say. It's more of, how long is this going to affect my ability to have money in my household? And that seems to be the one thing that kind of just sticks out to me the most about the feelings in the community.
And Caitlin, Charleston, much like Wilmington, a lot of service-related industries there. I'm noticing here a lot of those workers are already trying to file for unemployment. What's it like in South Carolina, where you're not under some of the same statewide orders, but like you said earlier, there are some county-wide and community-wide orders still trying to get people to social distance and that kind of thing?
Well, I will say the step the governor has taken is, just earlier this week, he did close non-essential businesses, which included the restaurants. He already made that order a couple weeks ago, but for non-essential businesses like bowling alleys, other sporting complexes like the trampoline parks, hair salons and that kind of stuff, they've all been ordered to close now for the next 15 days. So he's taking these efforts in small doses, it seems. There's not an outright stay-at-home order, but his kind of justification for that is we've been telling people to stay home from the very beginning, and people need to listen to what we're saying. But I think it's created a lot of confusion, though, and especially when the local municipalities are also taking matters into their own hands and passing their own stay-at-home orders. For the city of Charleston, that covers kind of like in Charlotte, there are different little suburbs of the city of Charleston. There's West Ashley, there's parts of James Island and Johns Island. And, where do you lay on that line for where the city starts and where it ends, and how that impacts what you're able to do? And I think also in terms of jobs, like you were saying, Jasmine, we've seen an unprecedented number of unemployment claims just within the last 2 weeks, thousands of people. And in South Carolina, our unemployment system is having struggles to get people's claims, to get their applications done. There's some concern about, is there going to be enough money to handle all of these claims as well? So a lot of confusion, a lot of concern. But then on the other side, there's still people that struggle to take it seriously. I just saw a post on Facebook in one of the Facebook groups the other day from a business owner in Charleston. I don't know if he was a restaurant owner or what, but he was talking about how the numbers we're seeing in terms of cases and deaths doesn't warrant the constitutional issues these orders are having or creating.
Well, I hope he stays safe. People need to take it seriously. Can any of you compare this, covering this outbreak, to anything you've covered before? You've all covered disasters. This is a new animal, isn't it?
I've never experienced anything like this. And, the one thing that I have tried to do as we've navigated these uncharted waters, if you will, is just ask people who have more experience than me. Have you ever lived like this in this career? I've been asking any doctor that I interview, I ask them that. Have you ever experienced this? Because it almost seems, at least for the first week, we're about to go into, I guess, a month of this. And it didn't feel, it felt like a movie. I don't know if anyone else felt that way. It felt like a movie. And, as the plans continue to become more and more intense, right, when it comes to the social distancing, okay, reporters and photographers don't come in. We're only going to sorry, that's my dog, single anchor shows. When things started to really have to change so intensely, you thought to yourself, is this really happening? I mean, something as so simple as going to meet a new person to interview them, and you both do this. You back up. Instead of going in for a handshake, you say, oh, I'm so sorry, social distancing. I mean, it's just all of the small ways and small things that were just a part of how we lived and worked have changed. And so I still feel like it feels like a movie sometimes. Like one day you're just going to wake up and say, okay, it's time to go back to regular coverage. But until then, I feel like you've just got these, at least for myself, blinders on of power through day by day, day by day. That's what I say every morning that I wake up, day by day. And in Virginia, I just got an alert. We're now at 1,706 cases of coronavirus. So, the constant stream of information every hour, sometimes minute by minute.
Yeah.
Day by day. That literally is the only way, at least for myself, to get through how different this whole thing is.
I will say that it does compare somewhat to hurricanes, though. But the biggest difference is that hurricanes, the reason for why we are evacuating or businesses are closed is so visible, the damage, whereas with this, you can't see it, it's kind of hard to comprehend. And like you were saying, Jasmine, it has been really surreal to report on it and to live it.
Right.
John, I was talking to somebody older at my television station, asking him that exact question, if he had ever, been around or experienced anything quite like what we're going through right now. And he kind of mentioned 9/11 being one of the big things that impacted, people around the world, he said. But even that didn't seem to be impacting people to the scale that obviously this is, worldwide, where everybody's dealing with this pandemic. And I just think the uncertainty of it is just one of the craziest parts about it. Just the fact that so many people are unsure exactly what lies ahead in just the next few weeks. And we look at these curves and charts and graphs and try to analyze the data based on what other countries have been experiencing. But at the end of the day, we're kind of just all playing it by ear. It's definitely unique to coverage for myself, but obviously we haven't been in the journalism game as long as a lot of people have.
Well,
Right.
one of the things that I tell people is that when 9/11 happened, if you were in New York City, or if you were in Washington D.C., or to a degree maybe Pittsburgh because of Shanksville, it impacted you right there and then, and your life was different. But 95% of the country went on with what they did the next day. You couldn't fly for a while, and we were all checked at airports. But outside of New York City, maybe New Jersey across the river, but most of the country were able to go to work the next day. Were able to go to the grocery store. Were able to go out and do what they did. And that's one of the things that I've noticed, Alex, to your point, is that it's different for the entire country and the entire world. At this point. This is a global thing, and that's the difference, I think, between 9/11 and this one, because somebody asked me the same question. 9/11 and this one, what's the difference? How are you priming yourself every day? There's a lot of information. If you're on a beat, you'll call your county commissioners, you'll call your police department, you'll call your sources. But how are you guys, Caitlin, I'll start with you. How are you priming yourself to be able to talk with the authority on what's going on every day? Because things, Alex said, it changes. And Jasmine said, we're sitting here and all of a sudden she got an update, something new changes. How are you priming to be an authority when you go on the air or when somebody asks you a question?
Well, and I think that that's the struggle for all of us right now, is that it's really hard to unplug even on your days off, because you feel like you will miss a big update that'll then impact your reporting on, your Monday. So I just try to keep an eye on Twitter, on Facebook. I'm constantly on my phone, more so than I was before. We have been using the Microsoft Teams app at my station, doing our morning meetings through that. So I think like all of us, we're just taking it day by day, and I try to take purposeful moments where I put my phone down, but then, I'll get a text message or something and it's right back in my hand, and I'm right back on social media or looking at our website or looking at our email, what's coming in there, because we are getting constant news tips right now, kind of like Alex and Jasmine, about people worried that their business that they have to go to work to isn't closed, and what does that mean for them? And then we have to explain, well, if it's an essential business, they can fire you for not showing up because they can still operate right now. So yeah, it's been a struggle, more so because it's an overwhelming amount of information, not the opposite where you don't have enough.
Alex,
Right.
how are you? Go ahead, Jasmine.
Oh no, I was just agreeing with Caitlin. It seems like both of my phones are constantly getting, whether it's personal text messages, like Caitlin said, from someone at a business or a corporation who feels unsafe, or checking in with the newsroom, or getting DMs on Instagram of story tips. And, at least on a personal note, I have to start every day with a little bit of yoga and a little bit of meditation just to get myself centered enough for how quick my mind is going to have to operate all day long. That's just something that I have to personally do to get myself in a good place. And I'm in a different situation because my husband works in healthcare. So we've now had to get to a point where when we come home and for dinner, we say, we're not going to talk about this for the next hour, because it's impacting his industry, impacting mine, obviously, and trying to make sure that we're really taking the time to just, unplug in that sense. But it's hard. Both of us need to know what's going on for our own safety, for our community's safety. I try to read the latest numbers and latest facts and figures, if you will, right before bed. And then first thing I do when I wake up is checking again. But I can check at 8:00. And from the time I woke up this morning to get ready for this podcast to now, I have my work phone. I think it's at least 7 different push alerts that I've missed, if you will. I can see them coming in. But we've been on this conversation maybe 20 minutes. So it's kind of I don't know if balance can be achieved right now. That may sound bad, but I think it's just accepting that we are going to constantly be taking in information, and that this is the time to make sure that we have our ear to it no matter what, because we kind of can't afford to miss something.
Alex, how do you prime? I'm sorry, go ahead, Caitlin.
I was just going to add, and I think for Jasmine and I, it's even harder because our off days are weekdays.
Yes.
Where the big updates are happening. If we had Saturday and Sunday off, our governor hasn't been having press conferences on the weekend, so it'd be nice to have a break from that. But because my off days are Monday, Tuesday, when some of the biggest stuff is coming down, if I'm not paying attention, I'm not going to be ready for my work week when it starts on Wednesday.
And my work week starts on Saturday, and the governor does his last briefing on Friday. So I have to tune in. It's at 2:00. I've got, even if I'm in my jammies, I tune in because I need to know, and I'm tweeting in real time because people don't necessarily know my off days. So I feel the obligation to give that information.
Sure. Alex, how do you prime to make sure that you're speaking with authority when you get the thousands of questions you get every day?
So I work the evening shift here, and I usually go into the office around 2:15, 2:30 p.m. So I do have I guess you could call it the luxury of being at home all day, and I can kind of keep network news on in the morning and then early afternoon. So I'm always kind of watching what some of the big updates are, whether they're the national updates or the global updates that are coming down. So I'm usually pretty refreshed on those. And then I have been anchoring the 5 o'clock hour for the last couple weeks, and just doing solo anchor show just because of social distancing. So you're all by yourself out there. And a lot of times the governor of North Carolina, the governor of South Carolina will do their press updates at 4 o'clock. So that's obviously before I'm on set. And a lot of times I'll try to go sit down with my laptop, watch, and just take notes, try to highlight the most pertinent information, the biggest updates, and the things that people are going to care about the most. So I've got those bullet points ready to go in my head. And again, we do that for North Carolina and South Carolina. And then obviously we've been watching the presidential coronavirus task force press conferences that have been happening as well. So I try to take notes on those. And then the fourth one that we also see a lot is Mecklenburg County, the county here that covers most of the Charlotte area. They do pretty routine press conferences as well. And sometimes those can happen even earlier in the afternoon. So I try to take notes about those as well, just so I've kind of got a layout, at least to know the top points in my head and have them written down on my laptop, which I've started bringing out to the anchor desk just to make sure I've got, the most important information with me before I get ready to go on air. So I think it's kind of like what Caitlin and Jasmine were saying. You're just trying to stay plugged in, and it's not really too hard to do that when it's, the only thing on the network news and you're getting all these push alerts and emails about it throughout the day.
Anybody had an oh wow moment when it went from a story to a different level of something? I mean, I think several of you have said we're living with this, but what's that oh wow moment? Alex, you shook your head first.
I think the moment I think I'm going to definitely remember the most, and I'm sure a lot of people across the country probably say this, is when the NBA shut down the season and the president the same night had just, I believe it was from the Oval Office, had given his address about the coronavirus pandemic. And they had called me and just said, we're moving you off of your story. The NBA just shut down the season. We have an NBA team here in Charlotte, the Charlotte Hornets, and they just said, get down to the arena and see if there are fans out there that you can talk to about this. And I went down there and talked to a couple of people who were just walking through the streets, and it had happened just minutes before I even got there because our station isn't too far from where the arena is in uptown Charlotte. And talking to those people, they hadn't even heard the news yet. And I said, the NBA season is canceled. And they're like, what? And I was like, yeah. And they said, why? I said, because of this coronavirus pandemic. And at that point, it still wasn't even in the forefront, I feel like, of people's brains that it is, at this point, obviously. So they were just like, wow, that's a big deal. I think that night is the one that I'm going to remember.
Jasmine, Caitlin, oh wow moment yet?
I would say so far, because I think more may come. But small side note of that, I hope the oh wows that come after are how the world comes together from this. I really hope that the oh wows can shift from shock in a scary or bad way. But I would say my oh wow would be the first night I solo anchored when Virginia cases were really starting to ramp up. And that same night we had our first death in the peninsula, which is a smaller area they were the first to kind of declare an outbreak of all of the municipalities in Virginia. And, you know, at that point, we had already reported X amount of cases and this and that. And it was from the time that I got in, because I got in that day at noon to shoot an interview and put together a package for the 6th. And there was just no break, no letting up from the information. And I remember coming home and just sitting down. And I think I literally said, wow, what a day. Because it was a foreshadowing, which I didn't realize, but it was a foreshadowing of what the next, again, month or more was about to look like. And I remember thinking to myself, wow, I can't believe this is happening like this. And wow, I'm so grateful for our team, because as we all know in local news, you work on a skeleton crew on the weekend. And we, from the web and producing and everything, I mean, we had stuff breaking in show, I think, that day. It was just a lot. I mean, more than we had experienced with our Saturday evening news. And so that kind of was that moment of, okay, you got to buckle up, because this is not going to get any easier.
Caitlin, have you had an oh wow moment?
I don't know if I've had a singular moment, but I will say what was kind of interesting to see is how the messaging has changed from the White House. Donald Trump, the president, was here a couple weeks ago when all this was kind of first starting for a rally in North Charleston, and that was the rally where he called the coronavirus a Democratic hoax. So it's interesting to just see how the messaging has changed from then until now, especially coming from the White House.
You all are about the age of my kids, 20s, but you have had to be, I would imagine, because I know I've had to be, you're reporting the facts, but you're also having to be reassuring to people in your community, probably people who are much older than you in the at-risk group for getting the coronavirus. So what's it like to be not only the messenger and the reporter and the anchor, but you're also having to be somebody that can say, okay, you're going to get your stimulus check. You're going to be able to apply for unemployment. You're going to be able to get tested when you need it. Because I'm taking this maybe that it's a little different hat that each one of you may be wearing that you've never worn before.
I think that this has shown just the critical role that we play as journalists, especially in times of need when people are looking for information and, you know, they might not have access to the internet or a cell phone that gives them push alerts every 5 seconds. You know, on the weekends, especially, I'm sitting there answering the phones while I'm waiting on the show. And every call is about someone's personal circumstance and how they're going to be impacted. And I try to answer the question the best I can. I'm not great at it. You know,
well, I'm sure you are.
Not all the information, you know, translates to someone's specific personal issue at that moment. So I try to just give them as much info or help as I can. But I think that that's been interesting to, you know, on one hand, there's been a lot of media bashing surrounding all of this, but then on the other, you have people relying on you for this information. And it just shows you how important your role is.
Alex?
It's a big responsibility. I think the best thing you can do is just try to hear what people are saying and then put yourself in their shoes. And then I think, as you guys kind of alluded to, just remind yourself, you know, how fortunate we are to have a job right now. And then think about how people are depending on us. And you're looking at emails we're getting from people who, as you guys have noted, are having trouble filing for unemployment. And that's obviously a situation, you know, I haven't had to deal with before, but I'm still in my 20s. But you try to imagine what it would be like if, you know, you were worried about your income coming in, and that's devastating to think about. And so I think as long as you just, you know, kind of stay grounded in the facts and look at what people are saying and digest it and take it to heart, I don't think it's too hard to try and play that role of the person who's delivering the message to the community, because we can see how serious this whole thing is impacting our country and the world.
I so agree. I think more than anything, it's humbling I think this job in itself is humbling, but I think that this time is even more so. I think it is this sense of this is the time to be, like Alex said, rooted and grounded in the facts, but also as human as you can possibly be. We are all in this together. We're all living this together. We may have different stories, we may have different circumstances, but this isn't a situation where we're reporting on maybe a disaster and then we can go home where our neighborhood was untouched. Like, we are in this with our community in more ways than probably we can describe, because what people don't know is every reporter or anchor may have their own story or their own family struggle based on what's going on. So yeah, I think it's that sense of being able to really relate to people, because we are dealing with this as well.
And you alluded to this earlier, Jasmine, with your husband, who we had a conversation not long ago, who works in a different area than you and is on the road an awful lot. So you do have that family concern. When you take off the reporter hat, how are you dealing with it emotionally with your family? How is it? Are you checking in with mom and dad? Are you checking in with brother and sister a lot more?
Yeah, so, my parents live 4 miles away, and my mom, who has asthma, so obviously I have, my own concerns about her. She'll come by and she just will come and she'll be outside, and, because of us still being out and about, we just want to be careful. We do a lot of FaceTimes. I try to call family members just to say, hey, check in. Same thing with my news friends, checking in, whether it's just a text message, here and there. The other part of my life is that I am a bonus mom. So we don't say step in the family, we say bonus. And because of this situation, our daughter, who lives in Cabarrus County, is not able to be with us and not able to see us. And we are all trying to figure out, will this be lifted so we can have our summer vacation, because she lives in Virginia during the summer. And so we talk almost every day or every other day, and we sent her a care package full of educational things, and we're working with her mom and trying to figure out the best way to support her while she's learning from home. And there's just a lot of disruption, and a lot of things have had to change for us in a personal way. And so we're thinking, okay, well, Marcel's, my husband, is a physical therapist. What if they close the physical therapy gym? Is he still going to get paid? These are the things that we have to think about, on top of how's grandma doing, how's baby girl doing, and reporting to work every day.
And I've got a package at 6 and a VO bite at 5, and I've got to get everything done.
Right. And at 7:30 we have book club with Aubrey, because she's going to read to us tonight, on FaceTime. So it's a lot of juggling and trying to navigate. It's a new normal. I mean, that's so cliche, but it just is.
Alex, your folks still live here in Charlotte. Are you checking in with them on a regular basis? How are you dealing with your family? Yeah,
they're in Wilmington. And so I touch base with them pretty regularly. They're pretty concerned about this, and they've always been, avid news watchers. So they're seeing all the updates, I'm sure, every day. And I don't know how good that is for your mental health sometimes, but they do check in routinely. And my mom will shoot me a text like she did yesterday and just be like, hey, you feeling okay today? Like, everything okay? Do you take your temperature? I'm like, yes, Mom. I'm doing all right. How are you guys doing, though? Because you guys, based on what we've heard so far, are the ones who are in more of that at-risk category. But they're doing good, too. And I know that they definitely take all the restrictions seriously and the guidelines seriously. So I know they're doing their best to stay healthy. And I've got a little brother, too, and he's in Raleigh, North Carolina. And he does a good job of paying attention to top headlines like this. And I know he's been okay too, and I don't think he's leaving his apartment much, but he likes video games, so I'm sure
he's all right.
He's not.
Caitlin, you and Alex are both engaged. What's it like for you? You've got, I'm sure plans here for 2020, and what's it like with the family and being engaged and balancing that with your job?
Well, I do feel really lucky that my fiance, he's able to work from home as well. So we're literally sitting at our dining room table right now across from each other.
I love it.
But I feel really thankful that both of us are getting a paycheck because, like we've said, so many people right now are struggling with that. In terms of my parents, it's been a bit of a struggle to get at least my dad to take it seriously. He's finally on board now and, not going out as much. I've just really been urging that with them because my mom has diabetes, one of the high risk categories as well. And then my grandfather on my mom's side, he's in his 80s and he's really struggling with staying home. I told him, just try not to go out. Let one of my cousins get your groceries or whatever. And I live like 3 hours away, so I can't do it. But his wife passed away a couple years ago, and he already feels very isolated, staying home a lot. And that was like his one thing, to go out to the store to kind of get his mind off of it. And, he's had a little bit of attitude back to me when I say you need to just stay home, because that's like his highlight of the day, to go out to Walmart and pick up a loaf of bread or something. And then my little niece, she is just over a year old. She was actually sick the other week. She had a fever for 4 days. And finally the pediatrician was like, all right, bring her into the office, and she had to go through a COVID-19 test. Luckily it was negative, but my sister-in-law was just telling me how surreal it was to go through one of the kind of drive-through testing sites. It felt like she was in a movie, she said. So I think, everyone is feeling it in their families in some way.
Well, go ahead, Alex.
I just had, Caitlin, when are you supposed to get married?
Not till March 2021, but it's like, I don't feel like I can even plan anything right now. I mean, this is kind of the point, like a year out, when you start going dress shopping and stuff. And first of all, everything's closed. Second of all, I feel guilty even like wanting to go do that right now because of everything that's happening and people out of jobs and stuff. And then also, like, how long is this going to go? I think it's so uncertain. I don't know. It feels weird to be planning a wedding right now. Plus, some of my friends, they've had to delay theirs. What about you, Alex?
Yeah, we're supposed to get married in late May. So, things are looking, I know. Things are grimmer by the day. And I say that, like you said, Caitlin, my fiance is literally at the same table as me right now. So that's on a personal level. We know there are much more important things happening, but that's a big day in our own lives. And so that's been a stressor. And right now we're looking at potential backup plans. So it's a lot. It's a lot.
Yeah.
It's amazing.
One thing I said is I'll never take giving someone a hug for granted ever again when this is over. Ever again. I miss hugging my mom so much. I miss just hugging people I love. It sounds so, oh my goodness, but it's the small things.
Or even shaking someone's hand.
Yeah.
I have, as we're sitting here today, I have tomorrow off, and Sheila and I were talking about possibly driving up to Raleigh to see our grandson. Can't do it.
Yeah.
We're FaceTiming and everything else like that, and I'm afraid he's going to take our first steps before we're able to see him again. But I'm hoping he says "pop, pop" before he says "Mimi." That'll be a little victory anyway. You guys have been great with your time, and I know it's very valuable. Before we go, one more time, Alex Giles of WBTV in Charlotte. Alex, it's always good to talk to you, and thanks for your time today, and thanks for peeling back that curtain and letting folks know a little bit about what it's like to cover the coronavirus.
Absolutely, John. Thank you for having me on, and say hello to everybody there at the station, and say hello to Wilmington for me. I miss it.
I promise I will. Caitlin Stansel from WCSC in Charleston. It's always great to see you as well. I appreciate you getting up and putting those headphones on for this podcast interview.
Thank you, John. And it was a pleasure. It was so great to see you all. Miss you all. Tell everyone when I said hello as well.
And Jasmine Turner from WWBT in Richmond, reporter and weekend anchor. It's always great to talk to you as well, Jazz.
Always. Thank you for this. This was good. It was good to see all of your faces. 3
rising stars in broadcast journalism, ladies and gentlemen. So glad to have them in the podcast this week. Thank you all.
Thank you.
Stay safe, guys.
Stay safe and well.
For everything coronavirus, just go to WECT.com. We have a dedicated page on our website with the latest information on the virus, the details coming out of Raleigh and Washington, D.C., many of the answers to your questions, and phone numbers to call if you need help. Once again, that's WECT.com, also available on the WECT News mobile app. Now, before we go, I would like to ask you a favor. Please download and subscribe to the free One-on-One with John Evans podcast on whatever app you use to listen to your favorite shows. And if you would be so kind, please leave us a rating or a review. We really do want to know what you think about our conversations, and the more ratings and reviews we have from people like you, the higher we'll be listed on the apps and the better chance we'll have of bringing in even more new listeners. I'm John Evans. Please stay safe. Thanks so much for joining us for this week's episode of One-on-One.